So moving down to the county level, the countywide, and this includes all testing sites. We've performed 163,000 COVID tests since the beginning of the pandemic. We have 17,800 confirmed cases, so 909,000 at the state level, 17,800 within Tulare County. That translates into a cumulative positivity rate of 10.9%, so more than double the 5% that we see at the state level. So we definitely have had a greater outbreak here in Tulare County than other parts of the state. In fact, Tulare County still ranks fourth among the 58 California counties in terms of the positivity rate. Or in terms of the number of cases per 100,000 population. We also, unfortunately, we rank fifth in the state in terms of the number of deaths from COVID per 100,000 population. So that's our cumulative positivity rate. Again, we're more interested at the county level in the recent positivity rate, and we've seen a vast improvement, since the beginning of the pandemic, moving from this 10.9% cumulative positivity rate to only 4.6% over the last 7 days. That 4.6% actually puts us in Tier 3 of the governor's blueprint for a safer economy. Tier 3 is orange, so you have Tier 1 purple, which is the most restrictive, widespread COVID outbreak. Then you move into Tier 2, which is red, then Tier 3, which is orange, and then Tier 4, the most liberal, loose restrictions, so Tier 4, which is yellow. So in terms of our overall positivity rate, we're well below the 8%, that if you're above 8%, that keeps you in the purple tier, the most restrictive. So amazing to see that we've dropped down to 4.6%. And remember, the numerator is the number of positive cases, the denominator is the number of tests you performed. So that's why we want to do more and more testing if possible, and ideally test people that are virus-free. So then you get 0 on the numerator and 1 on the denominator, and your positivity rate is 0 in that case. So I think that positivity rate falling to 4.6% is a reflection of more testing occurring throughout Tulare County, but hopefully also fewer positive cases. The health equity positivity rate, which I think I spoke of extensively at our last telecast, and that is that same positivity rate, but it's the positivity rate that is observed in the census tracts. There's 77 or 78 census tracts throughout Tulare County. You divide them into quartiles, and then those that have some of the lowest health factors, that probably has your most vulnerable population, a lot of congregate living, higher risk of infection, probably less access to testing and even medical care. How are we doing in those areas of the county? And very pleased to report that positivity rate for that lowest quartile census tract area is down to 6.6%. So again, well below the 8% that would put us in Tier 1. It would move us into Tier 2 red. So overall positivity rate, Tier 3 orange. Health equity positivity rate, 6.6%, so Tier 2 red. But unfortunately, lastly, the third metric is the number of new cases that we detect every day over a 7-day period. So that's the adjusted new daily case rate. And unfortunately, it's reported every Tuesday by the state. And this last Tuesday, and what the county is reporting right now, is we're at 8.3. 8.3 per 100,000 population of daily new cases. So you have to be below 7. So we have to see generally below 33, below 32 total cases per day. So We've been higher, we've been lower. Unfortunately, again, we've had kind of a slight tick up just over the last 7 days, which I'll mention in a moment here. But all three of those metrics, for you to move, or us to move into a less restrictive tier, have to be in that less restrictive tier or better. So unfortunately, they take the worst metric, and if that falls, whatever tier that falls into, that's what you're classified. So even though we're orange and red in 2 metrics, we're still purple in that last metric, and so unfortunately we're still in purple, tier 1, most restricted. So now finally coming down to the local level, as of this morning, we have 29 COVID positive adults that are in the acute medical center. We had 1 positive pediatric patient, so a total of 30 positive cases, and then we have 2 more adults that are suspected of having COVID, but we're waiting for their test results to come back. Generally, somebody that's suspected generally ends up being positive. Mm-hmm. So in all likelihood, we've got 32 positive cases today in the hospital. Contrast that with just this most recent Saturday. Last Saturday, we only had 14 total positive cases, and we were all celebrating. We've seen that number continue to come down, mm-hmm. hit that low mark of only 14 on Saturday, and starting to feel really good. But we were, obviously reading at what was going around across the globe, and then across the United States, the Midwest in particular getting hit hard. I'm down in Southern California, right on the border, El Paso and Mexicali, and just getting hit incredibly hard. But now, just 5 days later, we go from 14 to 32. So we are worried. The celebration was rather short-lived, and just reminded us that we can't relax. We can't, say, all right, it's over. I think that's what the virus looks forward to, is that we just, it needs a host. It loves lots of hosts, and so we just got to continue to be really vigilant, as difficult as that is. Of those 32 patients that are in-house, again, fortunately, we are seeing less intensity, less severity of their infection. We only have 6 of those 32 COVID patients that are in the ICU right now. We do have 7 patients that have been intubated. They're on a ventilator, so of the 32. Somebody asked me, I did a telecast with the Tulare Chamber of Commerce early this week, and they wanted to know how many total positive cases have been admitted to Kaweah Delta since the beginning. And we are, just like we're celebrating our 30-week anniversary here, we've now pretty much hit the 1,000 mark. We have now admitted 1,000 COVID-19 patients since the beginning of the pandemic. While our COVID numbers are relatively down, the hospital continues to be really, really busy. I know that's a frequent question I'm asked. The acute medical center, the adult occupancy rate right now today is at 87%. We only have 11 ICU beds open across our 2 units, and only 10 intermediate critical care beds across our 2 units. So not a lot of elbow room right now, which is what contributes to our nervousness, because we certainly want to see hospitalizations, COVID hospitalizations, stay down, particularly as we prepare to go into flu season. And then the last thing, in terms of our number of employees, as of Tuesday, Diane Cox reports out every Tuesday, we've had 385 Kaweah Delta employees that have tested positive, again, since inception. 26 of them are still out on leave, so virtually all have recovered. And again, that's a relative term. Right. And are back to work. We've had 13 providers, physicians or advanced practice providers, that have tested positive over the pandemic, and none of them are on leave at this point. So all 13, one of our providers unfortunately did pass away a few months ago. But the others have overcome the virus and are back at work.
Okay, the intubations, 7, that seems like a high number. Should we be worried about?
7 of the 32?
Yeah, that seems kind of high.
Not necessarily.
Okay.
Because you think about it again at the state level, 28% of the patient, or 28% of all those COVID patients that are in hospitals right now are in the ICU. And generally, if you're in the ICU, you're intubated. So the 6 patients that we have in the ICU, every one of them is intubated. So, so we're right.
So that's kind of following trends.
We're about that 28%, maybe slightly
Yeah.
lower. So we're kind of following the trend.